Welcome to another Medvarsity Deep Dive.
Oh,
Today
damn.
we're going deep into end-stage renal disease treatment options.
Interesting.
And it's not just about all the medical jargon.
Right.
It's really about the choices that people face when dealing with ESRD. What factors come into play?
Yeah.
What are the pros and cons of all the different approaches?
It's a big topic.
Yeah.
You really have to
Really have to think about this one.
think about this one carefully.
Absolutely.
Yeah.
So let's just jump into a scenario here.
Okay.
Imagine you're a doctor, and this 39-year-old man walks into your clinic.
Okay. All right.
And he's got some risk factors,
Mm-hmm.
obesity, slightly elevated blood pressure.
Mm-hmm.
He's complaining about swollen legs.
Okay.
Tests reveal protein in his urine.
Mm-hmm.
His GFR is around 40,
Okay.
and his creatinine levels are all over the place.
Yeah.
What's your first thought as a doctor?
The first thing is, I'm struck by his age. 39 is pretty young for potential kidney failure.
Right.
His stage 3B chronic kidney disease is definitely concerning,
Yeah.
especially with the obesity and the hypertension.
Yeah,
But
yeah.
the fluctuating creatinine levels,
Yeah.
those are the alarm bells for me.
Yeah, why is that?
Well, they suggest his kidney function is really deteriorating,
Yep.
and it's not in a stable or predictable way.
So it's not
Yeah,
just bad. It's
Unpredictable, too.
it's unpredictable, which is really scary.
Okay, so when...
This raises a big question.
Yeah,
When does conservative management just not cut it anymore?
right.
When do we really have to start thinking about renal replacement therapy?
Okay, so let's break that down a little bit.
Okay.
What are the red flags that scream, okay, it's time for dialysis or other forms of renal replacement therapy?
There are a few key indicators.
Yeah.
First, there are emergency situations.
Mm-hmm.
Think about dangerously high potassium levels,
Okay.
severe metabolic acidosis.
Or fluid overload that's stressing the heart.
Mm-hmm.
These are life or death situations
Yeah.
where dialysis is needed immediately.
Okay, so it's not
Yeah.
just about hitting some
It's not just a number.
GFR number.
Right.
It's how your body's handling the loss of kidney function.
Exactly.
Right.
It's the bigger picture.
Yeah.
We're looking at the whole patient.
Yeah.
And beyond those acute issues,
Mhm.
we have to consider the chronic symptoms,
Right.
the things that really affect a person's quality of life. Think
Mhm.
about fatigue,
Mm-hmm.
nausea, vomiting,
Right.
even really intense itching because of mineral imbalances.
Oh, wow.
These can be really debilitating.
Yeah.
Delaying dialysis might just prolong suffering.
So it's really about
Yeah.
striking a balance
Mhm.
between the downsides of dialysis
Right.
and making sure the patient has a good quality of life.
Exactly. And
Yeah.
that's where the discussion of the different types of renal replacement therapy becomes really important.
Okay, so we've got hemodialysis,
Yeah.
peritoneal dialysis,
Mm-hmm.
and then, of course, kidney transplantation.
Right.
But before we get into the specifics of each of these,
Okay.
can you talk a little bit about what ESRD treatment is like in India?
Yeah, that's important because access and resources are a huge part of decision-making.
Right.
In India, in-center hemodialysis is the most common.
Okay.
And there's a few reasons for this.
Mhm.
Patient awareness and preparedness are major factors.
Okay.
Sometimes people aren't even ready for the possibility of needing dialysis until it's an emergency.
That makes sense. It's hard to make decisions when you're in a crisis.
Yeah, absolutely.
And I'd imagine financial constraints also play a role.
Absolutely. The cost of home dialysis can be too much for many people,
Yeah.
and the support system for home-based treatments is often lacking.
Okay.
Plus, there's limited government or insurance coverage for peritoneal dialysis or home hemodialysis,
Right.
so people are left with fewer options.
So it sounds like access and awareness are huge hurdles in India.
They are.
Okay, so let's move on to the treatment options,
Okay.
starting with peritoneal dialysis.
All right.
Can you break down the two main types
Sure.
for our listeners?
There's continuous ambulatory peritoneal dialysis, or
Okay.
CAPD,
Mm-hmm.
which involves manually exchanging dialysis fluid during the day.
Mm-hmm.
And then there's continuous cycler-assisted peritoneal dialysis, or CCPD,
Okay.
which uses a machine to do the exchange overnight.
Okay, so peritoneal dialysis offers more flexibility
Yeah, that's the key takeaway here.
than in-center hemodialysis.
It offers a lot more flexibility and independence.
So the decision isn't just about what's most effective medically,
Right.
but it's also about what fits into a patient's life.
Absolutely. It's
And-
about tailoring the approach.
Yeah.
There's no one right answer when it comes to ESRD.
Mm-hmm.
We have to think about their medical condition,
Yeah.
lifestyle support system,
Okay.
financial situation.
It's about finding the best fit for them.
It really is.
So choosing the right path involves a pretty complex decision-making process.
Yeah.
What are some of the key things you think about?
One of the most important things is understanding the patient's values,
Yeah.
their goals.
Yeah.
What matters most to them? Do
Mhm.
they want to be independent?
Right.
Minimize disruption to their routine?
Okay.
Or maybe they want to maximize their chances of getting a transplant.
Hmm.
Once we know their priorities,
Right.
we can explore the options and see what fits.
So it's about seeing the whole person,
Exactly.
not just the symptoms.
Right.
Okay.
That's why open communication and a good relationship with your doctor are so important.
Yeah.
We need to create a space where patients feel comfortable asking questions,
Yeah.
voicing their concerns,
Hmm.
and making decisions they feel good about.
So it's about empowering the patient.
Absolutely.
Yeah.
To be a part of their healthcare journey.
It really is.
Yeah. And that's why we're having this conversation, right? To shed some light on the complexities of ESRD treatment
Yeah.
and help our listener navigate this really challenging landscape.
Absolutely.
Speaking of empowering patients,
Yeah.
we really should talk about kidney transplantation.
Right.
It's often seen as the best case scenario for ESRD patients.
Yeah. A successful transplant can really improve their quality of life.
Yeah, and even extend their lifespan.
Right.
Exactly.
So it's the closest thing to having normal kidney function again.
Right.
But it's not a simple fix.
No, it's not.
We need to be realistic about the challenges.
Yeah.
So what are some of the hurdles?
Well, finding a matching donor is often the first big one.
Okay.
It can take a long time.
Yeah.
And it's emotionally draining.
Right.
And there's no guarantee of success.
Even if you find a match,
Right.
there are still risks, right,
Absolutely.
with the surgery
Yes.
and the medications.
Yeah, the immunosuppressants
Right.
to prevent rejection.
You need those for life, right? So that comes with its own set of
Yeah.
problems.
Yeah, transplant surgery is a major procedure,
Right.
and long-term use of immunosuppressants can have complications,
Mm-hmm.
side effects.
So patients really need to understand both sides,
They do.
the good and the bad,
Absolutely.
before they make that decision.
It's a big decision,
It is.
and it requires a lot of thought and preparation.
But I guess the journey isn't always straightforward.
No.
Someone might start on hemodialysis
Right.
and then get a transplant later.
Exactly.
Or they might switch from
Mm.
CEPD to CCPD.
Yeah, as their needs change.
So it's about adapting to their situation.
Exactly.
Yeah.
It's
Yeah.
about adjusting the treatment strategy for each individual.
Okay.
And that's why patient education is so important.
Mhm.
We need to make sure people understand their options
Right.
and can ask the right questions
Okay.
so they can advocate for their own care.
You mentioned earlier that many patients in India don't know about dialysis until it's an emergency. How do we fix that?
Well, it's a complicated problem,
Mm-hmm.
but one thing we can do is talk about chronic kidney disease more
Okay.
and how it can get worse.
Mm-hmm.
We need to have these conversations earlier
Right.
so people have time to think about it,
Okay.
explore their options,
Mhm.
and make informed decisions.
So it's about being proactive,
Exactly.
not reactive.
Right.
Knowledge is power,
It really is.
especially when it comes to your health.
Absolutely. The more patients understand about ESRD,
Mm-hmm.
the better they can navigate this whole thing.
Yeah.
It's about moving away from just managing crises
Right.
and moving towards making informed decisions
Oh,
and
yeah.
planning ahead.
So it's not just about treating the disease.
Right.
It's about supporting the whole person
Exactly.
throughout their journey.
And sometimes
Yeah.
that means recognizing that the best approach
Yeah.
isn't always the most high-tech one.
Oh, interesting. Can you give me an example?
Sure.
Okay.
Okay.
Let's look at CPD.
Which is a type of peritoneal dialysis
Okay.
that doesn't need a machine
Oh, yeah.
and can be done at home
Mhm.
in some situations,
Okay.
especially in places with limited resources.
Mm-hmm.
CIPD might be more practical,
Yeah.
more sustainable than in-center hemodialysis
Yeah.
or even CCPD.
So it's about finding what fits the person's
Yeah.
life,
Exactly.
not trying to make them fit the treatment.
Right. What works for one person
Yeah.
might not work for another.
Really.
And sometimes that means
Mhm.
we need to step back from the fancy solutions
That's
and
right.
focus on what's practical,
Yeah.
accessible,
Right.
sustainable for that patient.
That's a good point.
It's a reminder that good health care
Yeah.
isn't always about having the latest technology. It's about using all the tools we have,
Yeah.
including the simple ones,
Mm-hmm.
to give the best care to each person.
And that brings us back to patient education and shared decision-making.
Exactly.
When patients understand their options and are involved in their care,
they're more likely to find solutions that work for them.
Yeah.
And that leads to better outcomes.
Mm-hmm.
And they feel more in control of their health.
Absolutely.
We talked about how ESRD treatment is different around the world.
Yeah, we've been focusing on India.
Right.
But I'm curious about other regions.
It's a good question.
Yeah, how do approaches and access to care differ?
Well, while the medical side of ESRD is the same everywhere, the resources available, cultural attitudes towards treatment, and the healthcare systems themselves all play a huge role in shaping the experience.
So can you give me a few examples of how these differences play out?
Let's take organ donation.
Okay.
In some countries,
Yeah.
there's a culture of donating organs, which means shorter wait times for transplants.
Yeah.
But in other places, cultural or religious beliefs can make it hard to get a transplant.
So the same medical condition can have completely different outcomes.
Absolutely.
Depending on where you live.
Exactly. And that's why it's important to look at this with a global perspective.
Okay.
There's no one right way to manage ESRD.
Right.
What works in one place might not be possible in another.
It's a reminder that healthcare isn't just about science.
Right.
It's also about social, cultural, and economic factors.
That's about people.
Yeah, it's about understanding the human side of this global challenge.
Absolutely.
Yeah, it really is amazing how just where you live can affect healthcare so much.
It really is.
Access to resources, cultural beliefs, government policies.
Yeah, all those things.
They really shape how ESRD is treated around the world. So it's important to remember that there's not a one-size-fits-all approach.
Absolutely not.
We have to think about all the different experiences and needs.
Right. Healthcare professionals need to be sensitive to that.
Yeah.
And understand the challenges that patients from different backgrounds face.
I think we've given our listeners a lot to think about today.
Yeah, I hope so.
We've looked at the many different aspects of ESRD treatment.
Right.
The medical options, the social and economic factors.
Yeah, all the things that go into making those tough decisions.
And hopefully we've made people curious about how these issues are being tackled, not just in India.
All over the world.
So to our listeners, if you want to learn more, keep digging.
Absolutely.
Explore what's available in your own community.
Yeah, talk to your doctor.
Ask questions.
Get informed.
Knowledge is power.
It really is.
Especially when it comes to your health.
Couldn't agree more.
The more you know about ESRD, the better you can advocate for yourself and your loved ones.
Right.
Thanks for joining us on this deep dive.
Yeah, it's been great.
Into the world of ESRD.
Oh.
We hope you learned something valuable.
I hope so.
And gained a new perspective on this global challenge.
Absolutely.
Until next time.
Yeah. Stay curious, everyone.
Stay informed.
And stay engaged.
Yeah. Keep the conversation going.
About healthcare around the world.
It's important.
It really is.